Entrepreneurship at Babson College. My colleagues and I are pleased to co-host this CUGH satellite session on global surgery, moving from policy to implementation, alongside our colleagues from the Center for Global Health and Development, Duke University, Loma Linda University, Harvard Medical School Program in Global Surgery and Social Change, Seoul National University, Stellenbosch University, and University of Utah. As I reflected on our theme for today, moving from policy to implementation, we hope that today is not only a moment, but a movement. And so with that being said, we're grateful to have many honorable guests that have joined us for this interdisciplinary convening. Here to introduce our first honorable guest is Dr. Key Park, the Director of Policy and Advocacy at the Harvard Medical School Program for Global Surgery and Social Change. Dr. Park.
Good morning, everybody. Good morning. Thanks, Wilgina. I have the honor of introducing the Vice President Alfredo Borrero of the Republic of Ecuador. Vice President Borrero is not only taking a leadership position in Ecuador in driving healthcare for the people, he's coordinating all of the healthcare from the Ministry of Health, Ministry of Finance, and Harvard Program in Global Surgery. We have been working with the Ministry of Public Health in developing a national surgical plan. But above and beyond that, Vice President Borrero has been a champion for surgical care and global health, not only in Latin America and Caribbeans, but globally. And some of you may remember the event in Geneva last year. Why is he doing this? The reason is Vice President Alfredo Borrero is actually a surgeon. He's a neurosurgeon. And it's amazing to have a person who gets it at the level that he is to influence global health and surgical care. So he has generously given his time today to support this day and what we're trying to achieve today. And he has prepared some welcome remarks. So Vice President Borrero, welcome.
Good morning. Muy buenos días.
Good morning, everyone.
Quiero saludar de manera especial a Kate Martin, director ejecutivo del Consorcio de Universidades for Global Health, al Dr. Key Park, director de Políticas y del programa de cirugía global de la Universidad de Harvard, a todos los que están aquí de manera presencial y a los que utilizando plataformas digitales nos acompañan en esta mañana.
Good morning to Keith Martin, Executive Director for Consortium of Universities for Global Health, and Key Park, Director of Policy and Advocacy at the Program of Global Surgery and Social Change. And to everyone present here this morning and those of you who are joining us through virtual platforms.
Para mí es un honor transmitir un cordial saludo de parte del pueblo del Ecuador, de su presidente Guillermo Lasso Mendoza.
For me, it is a great honor to be here with you today, and I bring warm greetings from the people of Ecuador and of the President of Ecuador, Guillermo Lasso Mendoza.
Todos conocemos cómo se define a la salud, y abro comillas. Es un estado de completo bienestar físico, mental y social que no solo responde a la ausencia de afecciones o enfermedades, cierro comillas. Alcanzar y sostener este estado para la mayor cantidad de personas es una de las funciones más elementales y la base de una sociedad justa.
We all know what the definition of health is, and allow me to quote, "It is a state of complete physical, mental, and social well-being, which is not only due to the absence of disease or illness," close quotes.
Achieving and sustaining this state for the greatest number of people is one of the core roles and the basis of a fair and just society.
La investigación y la experiencia nos han demostrado que el camino más efectivo y costo eficiente para mantener un sistema de salud son la prevención y la promoción. Pero es igual de cierto que independientemente de todos los esfuerzos que hagamos, un importante porcentaje de casos dependerán siempre de una cirugía, ya sea esta por accidente, por violencia, por catástrofes o complicaciones de otras enfermedades, porque la cirugía hace la diferencia entre la vida y la muerte.
Research and experience have shown us that the most effective and cost-efficient way to maintain a healthcare system is through prevention and promotion. But it is equally true that despite all efforts made, a significant percentage of cases will require surgery, whether due to accidents, an act of violence, disasters, or complications stemming from other diseases. Surgery truly makes a difference between life and death.
Es por este motivo que además de los esfuerzos que los gobiernos, en particular el nuestro de Ecuador, realizan en la salud pública, determinantes sociales como la prevención, la promoción y el tratamiento de enfermedades crónicas, de enfermedades vectoriales, raras y catastróficas, siempre habrá un espacio especial y fundamental para la cirugía, incluyendo el acceso oportuno, con costos asequibles y con la calidad esperada. Por lo tanto, nos enfrentamos al reto global de encontrar mecanismos para poder atender a millones de pacientes cuya vida depende de una cirugía y de esta manera, este reto, afrontarlo con solvencia. Esta es una responsabilidad histórica.
It is for this reason that, in addition to every effort made by governments, in particular that of Ecuador, in public health, social determinants like prevention, promotion, and treatment of chronic, vectorial, rare, and catastrophic disease, there will always be a special and fundamental need for surgery that demands timely and affordable access provided with the expected quality. We face the global challenge of finding mechanisms that will allow us to take care of millions of patients whose lives depend on surgery, and facing this challenge with solvency is our historical responsibility.
Las graves crisis sanitarias que hemos enfrentado, en particular la última, la pandemia del COVID-19, han puesto de manifiesto lo mejor y lo peor de nosotros. Por un lado, el maravilloso esfuerzo técnico para desarrollar vacunas efectivas en tiempo récord. Es una muestra de la capacidad de nosotros los seres humanos para defendernos de los riesgos a los que estamos expuestos. Además, hemos demostrado que con orden, con trabajo y en unidad, sí es posible superar obstáculos que parecían infranqueables para nuestras economías.
The serious health crises which we have faced, in particular the latest one, the COVID-19 pandemic, have exposed the best and the worst in our societies. On the one hand, we have the marvelous technical achievement of developing effective vaccines in record time, and that is an example of the ability of us as human beings to defend ourselves from the risks to which we are exposed. In addition, we have shown that through order and joint work, it is possible to overcome obstacles that appeared to be insurmountable for small economies.
Cuando asumimos el gobierno en mayo del 2021, anunciamos que íbamos a vacunar a 9 millones de ecuatorianos en 100 días. El éxito de nuestro plan de vacunación, donde logramos llegar a ser un ejemplo mundial, pues el 14 de julio vacunamos a 450,000 ecuatorianos en un día, con lo cual comprobamos las deficiencias de los sistemas de salud y tuvimos que diferir cientos de miles de cirugías. Cuando pudimos controlar la COVID, el estancamiento de las mismas fue evidente.
When we took office in May of 2021, we announced that we would vaccinate 9 million Ecuadorians in 100 days. And this was evident in the fact that we had a successful vaccination plan and we became an example to the world. To give you an example, on July 14th, we were able to vaccinate 450,000 Ecuadorians in one single day. Unfortunately, we were able to expose also that there were weaknesses in our healthcare systems, and that led us to hold back on hundreds of thousands of surgeries. By the time the COVID-19 pandemic was under control, the backlog in surgeries became evident.
Esta crisis, luego de lo que vivimos, no está superada todavía. Y esto nos debe llamar a la reflexión, a la unidad y a despertar el sentido de urgencia para lograr un acceso sin discriminación, un acceso oportuno y de calidad a todos los servicios sanitarios, y en particular a los de cirugía, anestesia y obstetricia. Tenemos la seguridad que todos quienes estamos en esta sala compartimos este deseo y desde ahora pido su compromiso para este ambicioso proyecto que se llama Cirugía Global, Anestesia y Ginecología Segura en el mundo entero.
This crisis is far from being over, and it should call us to reflection and unity and awaken in us a sense of urgency of the need to provide timely access to quality healthcare services that are provided without discrimination, and in particular to surgery, anesthesia, and obstetrics. I'm assured that all of us in this room share this desire, and I ask from the outset for your commitment to achieve this ambitious goal and objective.
Ecuador es un país pequeño de 245,000 kilómetros cuadrados, que alberga a 18,300,000 ecuatorianos, localizado entre Colombia al norte, Perú al sur, al este, el Amazonas, la reserva forestal más grande del mundo. La presencia del Océano Pacífico baña las costas y a 1,000 millas náuticas tenemos uno de los tesoros mundiales de la biodiversidad que se llaman las Islas Encantadas de Galápagos. Hemos dado un primer paso en nuestro país para fortalecer nuestro sistema quirúrgico, constituyéndole una prioridad nacional. Esto no es un tema de un gobierno, esto es un tema del Estado. Cuando terminemos, estos proyectos tienen que continuar independiente de quien lleve las riendas del gobierno. Sabemos que la atención quirúrgica tiene un papel fundamental, pues es un tema transversal, es crítico en la salud y en la percepción de salud. Queremos reducir la mortalidad prematura, las discapacidades, aumentar el bienestar de la población y la productividad y sobre todo darle a la ciudadanía la seguridad que si debe someterse a un procedimiento quirúrgico, cualquiera que este fuese, una cirugía programada o de emergencia, el sistema nacional está en condiciones de hacerlo oportunamente, con calidad y sin discriminación alguna. Es la verdadera construcción de justicia social y equidad.
Ecuador is a small country, averaging 245 square kilometers, and its population is 18.3 million Ecuadorians. It is surrounded by Peru, Colombia, the Amazon, and the Pacific Ocean. And 1,000 nautical miles away, we have the enchanted islands of the Galapagos. So in practice, we have taken the first step to strengthen our surgical system by making this a national priority. This is not an issue of a government, but it is an issue of the state that should transcend administrations. We know that surgical care has a fundamental, cross-cutting, and critical role in health and in the perception of health. We want to reduce premature death and disability, increase the well-being and productivity of our population, and above all, give citizens the assurances that if they need to undergo surgery, whether planned or emergency surgery, the national healthcare system will be able to deliver in a timely fashion with the expected quality and without any sort of discrimination. That is truly the way to build social justice and equity.
Hemos liderado esta iniciativa como médico, como neurocirujano y como vicepresidente de la República en funciones, con un trabajo coordinado entre el Ministerio de Salud, la academia, y hemos superado la fase de diagnóstico con un levantamiento minucioso de información. Hemos realizado talleres, el acompañamiento de la Universidad de Harvard ha sido fundamental. Hemos validado la información para abonar a un plan de acción concreto y sobre todo alcanzable. Esto es parte de un entendimiento. Cuando estamos juntos con objetivos comunes, se nos hace más fácil la construcción de sistemas saludables, equitativos y justos. Priorizamos las claves de intervención inmediata y sobre todo la pertinencia territorial. Ecuador está dividido por los Andes ecuatorianos en 3 zonas geográficas: la costa, la sierra, donde está la capital Quito, y la región amazónica. Queremos tener una visión de salud que se destaque por cuidar a la mujer, una incidencia muy alta de mujeres jóvenes embarazadas, de madres niñas que cuidan niños, y por lo tanto tenemos que sostener un servicio que constituya en una ayuda tanto en la parte ginecológica y obstétrica como en la parte quirúrgica.
We have been leading this initiative. I, as a doctor, as a neurosurgeon, and as the Vice President of Ecuador, in coordination with the Ministry of Health and Academia. And we have already completed the diagnostic phase after a comprehensive collection of data, workshops where we have had the fundamental support of Harvard University and the validation of this data. And all of this will support a concrete and especially an achievable action plan. Furthermore, this is based on understanding the key immediate intervention actions that have been prioritized with a territorial character and relevance. We know that Ecuador is divided into 3 geographic areas: the coastal area, the mountain area, which is where Quito, the capital, is located, and the Amazon area. We want to have information systems that lead us to improve our maternal health, women's health, and sustainability in basic and surgical services. We know that there are many young pregnant women in our country, and where we have girls who are mothers who are taking care of children. And all of these are our priorities.
Para completar este gran propósito, hemos convocado al sector público, al sector privado, a la academia, a la sociedad civil y a los organismos internacionales. Todos juntos debemos trabajar con objetivos comunes: logrando basarnos nuestro trabajo en temas tangibles, realizables, para lo cual requerimos de miradas y de oídos atentos. Estos deben estar dirigidos hacia el corazón de las familias y las comunidades, con una visión muy clara hacia las personas más desprotegidas y vulnerables de nuestras sociedades.
In order to reach this lofty goal, we have convened the public sector, academia, professionals, civil society, the private sector, and international organizations so that we can all work jointly to achieve these very tangible and achievable goals. And all of this requires our watchful and watchful eyes and careful listening. We need to focus our hearts. We need to focus our efforts on the hearts of families and communities with a clear vision placed especially on those who are most vulnerable.
En nombre del Ecuador, de nuestro gobierno, quiero agradecer profundamente el gran apoyo recibido por todos los actores que nos han acompañado en este proceso y que reafirman cada día su compromiso con una salud oportuna, equitativa y responsable. Este propósito común, con trabajo, decisión y entereza, vamos a alcanzarlos juntos, porque juntos podemos lograrlo.
On behalf of Ecuador and of our government, I am deeply thankful for the great support that all key stakeholders have provided and who have supported us in this process, who reaffirm their commitment every day for timely, equitable, and responsible healthcare. This common purpose of ours, through hard work, decisiveness, and integrity, is a goal that we can achieve. Together, we can do it.
En espacios como este, precisamente, es donde se construyen los caminos por donde nuestra población transitará con pasos firmes para alcanzar el sueño de cirugías accesibles, seguras y oportunas.
It is precisely in spaces like this one, where roads are built for our populations to travel confidently towards achieving the dream of accessible, safe, and timely surgery.
Muchas gracias a todos ustedes, señoras y señoras, que tengan un día maravilloso y cuenten siempre con nosotros para lo que quieran construir y para lo que puedan y podamos lograrlos en unidad. Muchas gracias.
Thank you. Thank you very much, ladies and gentlemen. May you have a wonderful day, and you can count on us to build whatever you need to build with our help. We're here for you. Thank you.
Thank you very much, Vice President Barrero, for those comments. Very powerful. Our full session today focuses on the field of global surgery and the role of innovation and entrepreneurship in implementing sustainable strategies for change. Our day will include 4 sessions that illustrate the field's current state and challenges, opportunities, examples of success, and actionable next steps. This event would not have happened without the tireless support of Dr. Keith Martin. Dr. Martin is a physician who, since September 2012, has served as the founding executive director of the Consortium of Universities for Global Health. We are very fortunate to have him with us. Dr. Martin, welcome, and thank you for sharing your opening remarks.